Continue with the topic, that is the development of the male and female reproductive system. So now the early and primitive genital tracts, they have the same appearance in both male and female embryos until 7 weeks of development, consisting of two paramesonephric or Mullerian ducts, two mesonephric or Wolffian ducts. Mesonephric ducts persist as the male genital ducts. Paramesonephric ducts develop bilaterally from invaginations of coelomic epithelium on the lateral aspect of mesonephros. Invagination of the coelomic epithelium opposite the cranial end of each mesonephric duct creates an epithelial bud. It penetrates the mesenchyme and progresses caudally along the mesonephric duct. The bud hollows out at the same time as it grows and thus becomes an open paramesonephric duct. Paramesonephric ducts cross in front of mesonephric ducts at the lower pole of mesonephric body and then run alongside it. Terminal parts of mesonephric duct fuse to form a small single median duct that is called as uterovaginal primordium or canal and ends blindly at the posterior surface of urogenital sinus. The blind ending projects into the dorsal wall of the sinus to create an elevation that is sinus or Mullerian tubercle, which is located between the openings of mesonephric ducts into the urogenital sinus. Before week 7 of embryonic life, the gonads of both sexes are identical in appearance. Y chromosome has the testis determining effect on the medulla of the undifferentiated gonad. Primary sex cords differentiate into seminiferous tubules in the male. Without Y chromosome, an ovary forms. Number of X chromosomes is unimportant in sex determination. It is, if a Y is present, the embryo becomes a male. If there is no Y, a female develops. Loss of sex chromosome, that is XO or X0 females, cause ovarian dysgenesis. 2 X chromosomes are needed to complete the ovarian development. The development of a male urogenital system is caused by the action of androgenic fetal hormones produced by fetal testes. They take effect at the end of the month 2, as seen by regression of the paramesonephric duct structures and differentiation of the mesonephric structures. Development of the upper portion of the male genital tract after regression of the mesonephric body. Gubernaculum ligament inserts at the inferior pole of the testis, that is the upper connection, and in the inguinal region, that is the lower connection, forming the so-called gubernaculum testis. Both paramesonephric ducts regress completely in the male by week 11. It persists as appendix testis at the superior pole of each testis. Utricus prostaticus or prostatic utricle persists from the early joining of the paramesonephric duct, stays at the back of the urogenital sinus between the mesonephric ducts. Mesonephric ducts persist and develop as follows. Most cranial portion forms the appendix of the epididymis. Segment of the mesonephric duct opposite the testis forms epididymis. Below the testis, mesonephric ducts acquire a thick investment of smooth muscle and forms the ductus deferens. As each ductus deferens joins the posterior side of urogenital sinus, 2 lateral outgrowths form the seminal vesicle. Ejaculatory duct is portion between the seminal vesicle and the urethra. Ejaculatory ducts open on the posterior wall of the urogenital sinus on an elevation called the veromontanum or seminal colliculus. Seminal colliculus is the remnant of the Mullerian tubercle and is homologous to the hymen. Prostatic utricle is seen between the ejaculatory duct openings. It opens on the colliculus in the prostatic urethra and is probably homologous to the vagina. Urogenital sinus, caudal to the union of mesonephric ducts, consists of a vertical pelvic segment and a horizontal phallic segment in the genital tubercle. Pelvic segment, epithelial buds begin to detach themselves from the posterior aspect of urogenital sinus on both sides of veromontanum during month 3. They penetrate the adjacent mesenchyme and form glandular epithelium of the prostatic gland. Prostate encloses ejaculatory ducts and the prostatic utricle and completely surrounds the prostatic urethral area of the urogenital sinus. Prostatic urethra is composed of cephalic half between the bladder and veromontanum, which belongs to the urinary system of urogenital sinus, caudal half between the veromontanum and the cranial part of pelvic segment of the urogenital sinus. Remaining pelvic segment forms the membranous urethra. Membranous urethra is continuous with the phallic segment of the urethra. Pea-sized bulbourethral or Cowper's gland developed from paired endodermal outgrowths from the membranous urethra. Cloacal membrane in week 3 is gradually surrounded by mesenchyme from primitive streak. Mesenchyme forms a pair of elevations, the cloacal folds, which fuse with each other in front of cloacal membrane to form the cloacal eminence. The cloacal membrane in week 6 is subdivided by urorectal septum into urogenital and anal membranes. Cloacal swelling are split into genital and urethral folds. Genital or urethral folds. The membranes rupture a week later to form urogenital and anal openings. Cloacal eminence elongates by week 4 to form genital tubercle. Another pair of elevation, labioscrotal or genital swellings, are seen on each side of genital folds. In the male, the swellings differentiate into scrotal swellings. In the female, they become labia majora. Thank you.